therapy. So please welcome Francis O'Connell.
Okay, well, it's my pleasure to be here, and thank you, Steve, for the very nice introduction. And hopefully nobody holds it against me that I was in the Coast Guard, because I know they can be quite onerous sometimes. So what I'm going to hope to talk to you about today is getting in touch with us, how we work, who the doctors are that are going to be talking to you, and just some medical stuff and some things that you want to think about in preparation. Some of the things that I'll cover have already been covered, and if that's the case, we'll speed through that part of the presentation. So these are my credentials. Enough said. I don't need to. I think Steve did a nice job of doing the intro. So who are we? George Washington Emergency Medicine Department formed this group, Maritime Medical Access. We've been practicing emergency medicine in remote marine and aviation arenas for over 25 years. It's actually started by the guy who eventually became the dean of the medical school. And we do deal with commercial vessels, but we also do a lot of advice and consultation with recreational ones. So we are used to speaking to people who are lay people, all the way up to physicians. We also back-end some of the cruise ships as well. So all of the people you speak to on the phone are emergency physicians that practice at the George Washington Emergency Department. These are physicians who are specifically hand-selected. It is a group of about 5 to 7 physicians, depending upon the size of the group and the year. But there are 3 core physicians. I am one of them. And most of us, for instance, I take 8 days of call out of the month. So about 24 of those days are covered by 3 of the physicians in our group. And that's a 24-hour, we're available 24 hours. And we'll talk a little bit about how that works. So this is what I know about the Pacific Cup. I looked at finishing times, and it looks to be about 8 to 15 days, which a lot can happen in that time. And I know that some of the boats that are going to participate will be two people, and that is the worst case scenario if we're talking about a medical emergency, but it can also be the best case scenario in that you're only dealing with 2 people. We'll talk about a little bit about that in preparation. So why am I here? This is sort of a generic plan to Hawaii. This is probably where you're going to experience your medical emergency. So you can see that it's really close to land. So this is my brief outline. We're going to talk a little bit about preparation. We're going to talk about some medical tidbits, things that may have not been covered, things that you'll realize are specific to medicine, and telemedicine at sea and how that all works. So in preparation for your voyage, see your doctor. So someone had asked me when the best time to see the doctor is before your voyage, and I would say probably the day before, unless you were going to get bad news, and then maybe the day before that. So I would say as close to the journey as possible would be my recommendation. If you have real medical problems, you probably want to space that out to a point where you can get those under control before you sail. So in preparation for your voyage, these are the things that I would talk to your doctor about and things that you would expect to get depending upon your age. Obviously, your conditions may vary what goes on with your doctor. But the biggest thing is to discuss with the doctor about your voyage. And I would tell you that most physicians, when given the sort of opportunity to help you, especially when we're talking about giving you prescription medications, would be willing to give you prescription medications for certain things. I think the biggest issue would be narcotic pain medications, and that obviously is a big deal because one, it's a huge crisis in this country, unfortunately. But the second thing is that most physicians' prescribing habits are very closely monitored. And really do get that rash, lump, or other oddity checked out before you sail. Okay, in preparation for your voyage, Denny talked a little bit about this, but I would say it's certainly going to be confidential. I would get one for every crew member. I would make sure that they're laminated because you never know when you're going to have to be handling that. And the other thing is I would put them in a sealed envelope. This protects everybody's confidentiality. These are the things that you would want to include in that. And since you're going to get the PowerPoint presentation, I won't belabor that, but really it just covers all the basics. So we did talk about expiration dates. The only thing I would add to that is if you were the patient and somebody said, I can give you a medication that's not expired or expired, you ask yourself which one you would prefer, especially if you were having an allergic reaction and needed the EpiPen. I'll leave it at that. So obviously everybody, I'm assuming, has a satellite phone, but the most important thing is to make sure that you know how to use it. Most of the time, and there'll never be an opportunity for you to use it, but please make sure that you do, because the biggest issue is being able to maintain effective communications, especially when you're dealing with a crisis where you're going to have to follow up with people. And this is the Coast Guard part of me. I really do emphasize taking courses in these things, specifically survival, firefighting, first aid, and safety. The main issues are, I don't need to explain to this group, but for the people who are going to be new to this, you're an island unto yourself, and you're as strong as the weakest person on that boat. We didn't talk about AEDs, but I would say this: the use is controversial in the fact that you would be using it in a wet environment. I would say this: they have studied this, and there is a low transmission of electricity to other people, and we're talking about wet floors. I would say this: if you had a heart attack and you were 2 hours from sea or within 200 miles where a helicopter could get you, you would probably want the AED on board. It's the difference between somebody doing chest compressions and stopping because they're tired, and you being shocked back to life because your heart was in a rhythm that could be shocked back to a normal rhythm. So I'd ask you to consider it.
Hey, are there big differences in the quality of AED units that are being marketed?
So that's a great question. I would sort of say that most of the AEDs that are being marketed are good AEDs. The biggest question is what type, how much. Most of them fall within the $500 to $1,000 range. I know we're talking about a lot of money, but these are things that you'll want to consider. AED is probably last on the list if we're talking about medical outfitting, only because it's going to be something that you likely are never going to use. So I'll leave it at that. Okay. So we talked about medical kits. I know that Denny talked about it at length. I probably don't need to talk about it that much. But I would recommend probably getting a kit and supplementing it rather than going out and purchasing things on your own. Okay, so antibiotics, right? One antibiotic, good for everything. The truth is that they're not. And so when you talk about antibiotics, the things you want to know about are why is it given, what's the infection, where is the infection, because antibiotics work in a lot of different ways. The things that you may want to know are that, just as Denny mentioned, people will tier lists and tell you which antibiotic is the best. Ultimately, you want to have coverage, probably 2 to 3 antibiotics. I would probably opt to 3 and 4 if you could, because the truth is that one antibiotic doesn't cover everything. And the second thing is that the marine environment is unique. It's different than getting a cut here on land. So the antibiotic choices are obviously unique to the environment of being on a sailboat. Okay, analgesics. So we talked about ibuprofen. So it turns out ibuprofen, Motrin, and Advil are all the same thing. And it turns out if you take a lot of it, you can probably burn a hole in your stomach and shut your kidneys down. So the things that the government doesn't tell you is that when you purchase these medications off of the shelf, is that if you take a little bit extra, it can really be harmful. Specifically Tylenol, but ibuprofen can be very bad, as well as aspirin too. So these are not interchangeable medications, so please, if you're going to be using them, and we'll talk about this, even in small doses, and you find that you're going to be taking it for a while, please do call us or call us in advance of your trip. We're happy to tell you sort of the nuts and bolts of it. And yes, you can take Motrin with Tylenol. So they're metabolized differently, they work differently. But I wouldn't take it with aspirin. I would just leave it at Motrin and Tylenol. The other thing which is I'll mention here, which is important, and this is a good segue, about allergies. It's really important to know what people's allergies are before you start doling out medications on the ship. And people may not know that they have allergies to certain things. So even if people are going to take over-the-counter medications, please ask them, do you have any allergies? Because if they do, it's important that you know ahead of time. So if somebody hasn't, for instance, has an allergy to naproxen or naproxen, you don't want to give them ibuprofen. It's the same class of medication, and they can have a bad reaction. That's an example. I'm happy to take, we have the panel discussions. I'm happy to answer all the questions that you have. So seasickness medications, it turns out if you take a lot of them, they can make you go into a funny heart arrhythmia and you can die. So don't take too much meclizine. That would be my advice. Or take it as the insert tells you. Sure. If you take too much meclizine, just start popping them like Pez or Skittles, whatever fruity candy of your choice. You can go into a heart arrhythmia. And if you take meclizine and also have an allergic reaction to something else and then decide that you want to take Benadryl, it turns out that Benadryl and meclizine are in the same class, and they will block the sodium channels in your heart and cause you to go into a funny arrhythmia, which can only be reversed with a bicarb drip, which likely you will not have on your sailboat. So beware of the medication cocktails. I do want to talk about the pink stuff. So the pink stuff, how many people are allergic to aspirin? All right. Okay, there's one hand, 2 hands in the back. So it turns out that the pink stuff has aspirin in it. It's not exactly aspirin, but it, yes. Yeah, so bismuth subsalicylate, which sounds a lot like acetylsalicylic acid. It turns out you can have an allergic reaction to the pink stuff. So be careful. By the way, those are both over-the-counter medications. Okay, these are first aid must-haves. This is just to augment your kits because you'll always need extra. Some things about allergic reactions. So as I mentioned, it's important to know what people's allergies are before you give them medications. EpiPens, EpiPens, EpiPens. Can never have enough of them. I would have at least 2, preferably 4. And the 2 is probably good enough for the medical kit, but anybody who has an anaphylactic allergy should really have 2 of their own EpiPens. Everybody knows where they are. Albuterol is probably really useful in this sense, and most people think of albuterol with asthma, but it's also good if people are developing respiratory symptoms or having difficulty breathing if they're having an allergic reaction. Eye protection, eye protection, eye protection. You only have 2 eyes. The other thing that I'd recommend, because the marine environment is not really hospitable to contact lens wearers, I would really avoid wearing my contact lenses while you're out to sea. Now, obviously I can't tell you what to do, but if you get a nasty bacteria and you don't have the eye drops on board, wow, that's a really bad situation. So I would probably not wear my contacts while I was out at sea. And pack an extra pair of glasses or 2. Okay, so telemedicine, what's that really comprised of? So we do both face-to-face chat, and we do most of our telemedicine is just phone to phone. So why do we do it, or why is telemedicine important? Have you ever been on an airplane and they say, is there a doctor on board? You don't want the dermatologist helping you through a break. I mean, I love dermatology. It's fantastic. It's a good 9-to-5 job. It pays really well, but probably not going to help you out when you cut your finger, other than to tell you to put a Band-Aid on it. All right. So where are you going to use this? Well, the nice thing about it is it's portable, so wherever you are. The recommendations can change depending upon where you are because of licensing issues, unfortunately. So if you're here and your feet are in California, or you're within 3 miles of California, our recommendations are going to vary. And if you need to take medication, then we'll talk you through that. But there's legal issues, and I don't want to step on the California State Medical Board. So the truth is that whatever the emergency is, we will make sure that you are safe and make sure that we talk it through. You will not be left hanging in the breeze as to, no, I don't have a California medical license, therefore I can't give you advice. Generally, we talk in generalities, as in, if I had this medical problem, this is what I might do. So, and then we'll tell you to get out of the 3-mile limit. I'm only teasing, Kent. Okay, so I want to focus on the how, the who, and the when, because these are the most important things you want to know. So how do we do it? So you're going to call a number, and somebody who's a paramedic or an EMT is going to answer and take some preliminary information. And then within 2 minutes, they're going to get us on the phone, and then you're going to be talking to a doctor. But not just the dermatologist, somebody who does this for a living. And then we're going to figure out how we're going to help you. So one of my colleagues did a study and published it back in 2007. It was specifically with commercial vessels, but about 56% of the time, they could do everything they needed to do in one call. And then there were the psychiatric cases, which took about 15 calls. But hopefully you know the people you're sailing with and you won't have to deal with that. But mental health is a real thing. I don't want to minimize that. It is seriously. But it will take more calls. So ultimately what we'll figure out is the case resolved? Do we need follow-up, or do we need to involve the Coast Guard, or put out a broadcast to involve nearby ships? We'll figure that out. We'll take you through it step by step. You'll never feel in a situation that we won't have your back. So this is the Worldwide Emergency Communication Center. It's staffed 24/7. It's a recorded line. They take all of the information you need. It gets documented, and they get us on the phone very promptly. So these are the types of stuff that we deal with and use. I don't know if anybody has a kit where they can enable face-to-face, but if you do, let us know. We're happy to figure out how we can make that work with you. Most of the time, it's phone to phone, which is pretty simple. These are the people who are taking your calls. This is actually one of my colleagues in this picture. His name is Neil Sikka. He's one of the three. That battery of phones has now been replaced. There's like one phone, but it ties into many lines. The internet was an amazing thing. Okay, so when should you call? I think this is probably the most important slide. So I'll let you just take it in for a second. Keep it simple. Does it make you nervous? Does it affect the ship? But if it does, in either of those cases, call early, call often. I can't emphasize that enough. It's better for you to call and say, oh, you know, you're right, I knew that. I didn't need to call you. Rather than, gosh, I would have called you. I wish I would have called you 48 hours ago. Regardless, we're not there to scorn you. We're there to help you. But I'm here to tell you, call early. It's always beneficial. All right, this is what I've been told are the dates of coverage, and this hopefully will cover everybody to and from. The lengths of the call are as long as you need. You should never feel rushed on the phone. In fact, you will never feel rushed on the phone. I have one colleague, she set the record for the longest call. So I don't know, it was like 45 minutes. So, which is, if you need us to be there, we will be there for as long as it takes. I just want to give you some examples because I'm pretty close to wrapping up here. So injuries are the smallest percentage. They are. Most of it is medical illness. But some of the injuries we get are cuts are the biggest ones. Bumps to the head are huge. I don't know, ships just seem to be, or boats seem to be small places. I mean, Kent, you're pretty tall. I'm sure you can attest to that. It's a good thing you have a good head of hair. Yeah. Some of the other things we get questions are my crew members on this medication? They haven't taken it in 2 days. Is it safe for me to restart it? Should they restart it? When should they restart it? Some of the emergencies. Now, I'm here to tell you that fainting may not seem like an emergency, but if you're dealing with somebody who's never ever fainted before in their entire life, it's absolutely essential you call us, because the biggest things about fainting are things that are cardiac related, or, hey, you know, this crew member that I have just flew in from, I don't know, they had a 12-hour flight and they arrived and then they got on the boat and we got underway, and 3 hours later they fainted. And oh yeah, they were complaining of some mild chest pain. Well, most likely they have a blood clot, and so that can be life-threatening. Some of the other things that we've had to evacuate people off of ships and boats have been gastrointestinal bleeding, which we talked a little bit about. I don't know if it's published publicly, but the Coast Guard did launch a C-130 equipped with Air Force PJs to go to a commercial ship that was out actually between California and Hawaii, and they had called us. Unfortunately, the guy presented very late and his blood pressure was low, so he did not survive. But the point is that if there is a life-threatening emergency, the Coast Guard's got your back. That I know. So if it's bad, they'll send them for you. The other things are people who seem short of breath or out of breath, that it's very uncharacteristic. These are absolutely things we want us to call you. We want you to call us about, because there are things that we can help head off before they become real issues. You'd rather be dealing with somebody who's awake and talkative rather than doing CPR and knowing that there's not going to be a ship there for another 3 hours. James Betts is our program manager. Send him all the emails first. He can vet them. I'm just teasing. You can email me directly. So we do have a backend, so we have both administrators and PAs. And for instance, if you have a kit or you have a list of medications you would like to have reviewed before you get underway, please send it to us. We're happy to look through it and give you our feedback. Preferably at least 24 hours before you sail. All right, in conclusion, we're there, we're ready. Call early, call often. Thanks.